Glaucoma is one of the more common diseases that we treat at the ophthalmology group. It's a disease where high pressure affects the optic nerve. As the pressure builds in the eye, it damages the optic nerve, and if the optic nerve becomes damaged badly enough, you start to lose peripheral vision first. As the peripheral vision begins to go, then the central vision will even close off eventually. The biggest problem with glaucoma is that it is a symptomless disease. The only way you can find glaucoma is to test the pressure and to look at the optic nerve. The reason it's vital to get routine eye exams, especially over the age of 40, is that is when glaucoma begins to be more prevalent. As we age, glaucoma becomes more and more prevalent. And just because you don't have glaucoma at your first exam at 40 years old doesn't mean that you're not going to get it as you age. The main reason that we want to check for glaucoma on a routine basis is because it is a very treatable disease, but it is not a curable disease or a reversible disease. Once the damage from glaucoma is present, it cannot be undone. But if we see damage occurring at a slow pace, we can usually slow it down drastically or stop it. There are many different ways that we can treat glaucoma and slow the disease down. The first method that we use most of the time is with eye drops. Eye drops either increase the drainage of the fluid from the eye or they decrease the production of fluid inside the eye. Once eye drops don't work or we find that people are intolerant to eye drops, then we oftentimes will switch to a laser procedure. A laser procedure can also help the eye to drain more fluid. If the laser doesn't work, then we oftentimes will try to move on to surgical interventions. And this is where we've had some breakthroughs in glaucoma treatment over the last 4 or 5 years. There are several new procedures. Some of them are in the development stage and some of them are actually on the market already. One new one that our practice has been doing for about 18 months now is called the eye stent. It's a microscopic stent that is placed inside the eye at the time of cataract surgery. It actually opens up the drainage tube for the eye and lets the eye more effectively drain fluid. It's what we call a minimally invasive type of glaucoma surgery, so it has much less risk than traditional glaucoma surgery. If this type of glaucoma surgery doesn't work, then we oftentimes will move on to a more traditional surgery where we implant either a large plastic drain into the eye or we create a drain out of your body's own natural tissue. These procedures are mildly more risky, but also more permanent and with much better results as far as long-term success of reducing the pressure inside the eye. All of these different modalities of treatment can be used to slow down or stop glaucoma and prevent vision loss from the disease.